Well, COVID cases are spiking again. A 40% rise in cases in just the last 24 hours. Dr. Rajeev Dasgupta joins us. He's a member of the COVID-19 task force. He joins us from the national capital. Dr. Rajeev Jayadevan, also a member of the national COVID task force, joins us from Kerala. And Dr. Pinto is a consultant pulmonologist and epidemiologist who joins us from Mumbai. We will take all your questions to our panel of experts. But first, I want to go across to my colleague Priyanshi. Priyanshi, the new numbers look particularly grim.
That's right, Rishika. As you said, a 40% increase, and this is the highest new cases that we've seen since February end. 7,240 new cases recorded, which is a 40% jump. Now, yesterday also COVID cases went up from 3,000 to 5,000. Let's look at the top 5 states that are contributing to this number. Number 1 is Maharashtra, which is recording more than, as you can see, 7,000 cases. Maharashtra is contributing the most to these cases. Maharashtra, Kerala are the top contributors. Maharashtra recorded 2,701 cases yesterday. Haryana recorded 247. Delhi at 564. Karnataka at 376. And Kerala at 2,271. So Maharashtra at top, followed by Kerala, and then Delhi, Karnataka and Haryana. These are the cases that the states that are recording the most cases. Now let's look at how we went from actually less than 2,000 cases to now over 7,000 cases. In the end of May, we recorded less than 2,000 cases, as you can see on this graph, but the cases started increasing ever since, and now we're up to 7,000 cases. Even the average weekly cases, the daily average for 7 days has gone up from 2,000 to now over 4,000. Earlier it was around 2,000 in the last week of May, and now it's up over 4,000 cases. Now, as we know, that deaths have not been increasing so much, but the reproductive rate, that is the R factor, is above 1, meaning one person is infecting more than 1 people with COVID. So definitely these numbers are concerning. Too soon to call it the fourth wave as per experts, but the numbers do show a very sharp rise.
All right. Thanks very much, Priyanshi, for joining us with all those numbers. Let's just, decipher some of that information with our panel of experts. Dr. Pinto, I want to begin by asking you, because obviously the first question that comes to mind is, are we heading towards a fourth wave, even though many believe it may be too premature to call it that just yet? But a 40% spike in 24 hours is pretty big.
Hi, Rishika, and thank you for inviting me to the show. I definitely think this is possibly a surge, possibly a wave as well. Also because the actual numbers are probably underestimated significantly compared to earlier waves, simply because a lot of individuals are testing at home right now. So there are rapid antigen kits which are available. A lot of individuals have possibly made peace with the fact that, viral infections do happen and they don't necessarily need to test. So number 1, testing rates might be lower than before. Number 2, a lot of individuals getting tested at home will not get recorded in the numbers. So the actual numbers possibly are a lot higher than this. Now, while that may be the bad news in terms of the overall sum total of numbers, I think what's still reassuring is that we haven't seen a huge rise in the number of hospitalizations or the number of deaths yet. And this would potentially be our second surge that we are experiencing post-vaccination. So significant proportion of individuals getting vaccinated. And if our experience from January, from Omicron is something to go by, hopefully this will also result in large numbers, but maybe most infections will be mild, which is what we're seeing so far as well.
But I think it's an important point that you make, which is the fact that these numbers are perhaps estimated, given the fact that most people now are relying on home tests, in order to sort of get by. Also, because of vaccination booster doses available, the severity of infection, thankfully, so far remains low. 2 other questions, Dr. Jayadevan, if I can come to you. One is, how is the disease manifesting differently? Is there any difference in the symptoms that we are seeing? What are the predominant variants that one believes are in circulation right now, and how is it really playing out, the disease manifestation?
Yes, as of now, in India, we believe that it is mostly the BA2 variant, and then INSACOG has confirmed that BA4 and BA5 have also arrived in India, as in other parts of the world. We don't have a lot of genomic sequencing, as you know, in different parts of India. But this is the information that we have at this point. You asked about the clinical manifestations. Yes, at this point, all of these sub lineages of Omicron, they're all daughters and granddaughters or grandsons of Omicron, and they all have pretty much the same clinical profile as Omicron had. You know that Omicron had a milder profile compared to Delta. So what we are seeing right now on the ground are mostly mild cases. Many are without symptoms. So, and as Dr. Pinto said, people are not testing as frequently as before. So we are looking at the tip of an iceberg, which also means that looking at the rising TPR, like where I sit here in South India, it is 18.29 in the city of Cochin at this point, TPR. And we know from published information from local data that the higher the TPR is, the more the spread and the more people are getting affected. And as more people get affected, eventually we will see an uptick in the hospital admissions. We're already seeing that over here. There are a few patients who are requiring oxygen. These are mostly older individuals and who have substantial other associated disease conditions. So it could be either the condition that is getting worse or the COVID itself. So both can happen, as you know, with COVID-19.
Sure.
But for our viewers, I think they should understand that this is a cyclical disease. It is not going away. The most important message is this is not the common cold.
I think it's very, very important that you say that this is not a common cold. You can't take COVID lightly. Because remember, you may get infected and hopefully it will be mild for you, but you do have the potential to infect somebody in whom, this could perhaps manifest as a serious disease, especially if you have older and vulnerable people. You have to be extremely careful. Which brings me to my next question, Dr. Dasgupta, on boosters. Do we need to, given the fact that we're seeing this uptick in cases, do we need to perhaps reconsider the gap between the second and third dose and make the third dose and perhaps now a fourth dose, more easily accessible?
Right. First, this current surge is most likely on account of BA4 and BA5.
Right.
If the track record of these are anything to go by from the South African experience, this is certainly going to increase very fast. Second, these are not causing any new symptoms or is in any way more severe than the circulating Omicron. In fact, these also belong to the Omicron family. But yes, coming to the boosters, the mantra ahead is going to be more genomic surveillance, where India certainly needs to do better. Linking the clinical and the epidemiological, again, where India needs to do better. Universal vaccination, where India has done quite well, but it's really the uptake of boosters where we are lagging, and that's going to have a significant bearing as variants will continue to emerge. And in fact, variants will continue to emerge or have a grip if the vaccination remains partial or there are pockets of unimmunized individuals. And therefore, it's boosters that we need to focus on, as well as completing the schedule of the two dose.
But let's not forget, Dr. Pinto, that we are still giving the third booster dose here in India, whereas there are several countries that have now started giving the fourth booster dose. So again, the question really boils down to the dosing gap. Between the third shot and the fourth, between the second shot and the third shot here in India. Does that now really seriously need to be reconsidered?
I think this is where data plays a very important role. If you look at what happened during Omicron, most individuals had not received a single booster when the Omicron wave happened.
Right.
And despite that, it did seem that most individuals were protected from moderate to severe disease. So I genuinely am not completely convinced that everybody under the sun needs to have frequent boosters. But if you are immunocompromised, if you have comorbidities that make you predisposed to having severe disease, these are the individuals who need to be boosted. And I think data is going to be very useful to tell us, what proportion of boosted individuals had severe infection versus not.
Right. Dr. Jayadevan, as a last question to you, once again, the concern comes in when it comes to the unvaccinated lot, which is children, children who are going to school or say are attending summer classes at the moment. A lot of schools are actually on vacation. A large section of school-going children are still unvaccinated. Do we really need to ramp up our attempts? We know that there are vaccines that have been approved, for instance, but none rolled out in the market.
Well, I have some very good news in answer to that. We've been constantly monitoring the situation here on the ground. Pretty much every week, we've been running meetings with doctors across the country in monitoring the situation. So for children specifically, since you asked, they are testing positive, obviously, as other individuals are, but the vast majority of them are extremely mild, just like the cough and cold that they get during the school opening and monsoon season over here. Serious disease is rare, and today I've just tweeted this paper that's just come out of Denmark that shows that with Omicron, the chance of a serious complication from COVID is about 8 times lower than Delta was, and especially lower in people who had prior exposure. So children are well placed.
But again, it raises the question on immunocompromised children. Not everybody will be able to fight it with the same sort of efficiency. So we do need vaccines to be rolled out for children. There are several countries that are already doing it. Dr. Dasgupta, is there anything that you'd like to add in terms of a precaution, given the fact that we are seeing this uptick in cases? What are some of the do's and don'ts that people need to perhaps revise, given this uptick?
Well, as we know that while on the whole, this is not going to cause, say, a Delta or an Alpha-like situation, but as my co-panelists have been emphasizing, those who are at greater risk, be it children, be it elderly, or be it those with some very specific chronic conditions or medications, they are the ones who should be certainly on extra caution. And that really is the task of the communication messages that need to be framed at this point.
All right. Well, you can't take COVID lightly. So, go out and get yourself tested. If you do have any of the symptoms, isolate, mask up and get your booster if you're eligible. I think those really are the rules of the game at the moment. Thank you all very much for joining us. We're, of course, going to monitor the COVID-19 situation across the country very closely here on NDTV. Short break here. A lot more on the other side. Stay with us.